Did you know that over 50% of people who have heart attacks actually have normal LDL cholesterol? So if you think your heart is safe because your LDL is normal, then think again. Or perhaps your LDL is high, but you're on the fence of starting medication or supplement and deciding whether you can just continue lifestyle changes. Well, then you'll want to stay tuned because I'm going to talk about other cholesterol tests and cardiovascular risk markers that might actually be a better predictor of your risk for heart disease. So stay tuned and your heart will thank you. Hi, I'm Dr. Var. I'm a board-certified family medicine physician and I am certified in functional medicine. Before we dive into the specific cholesterol tests, I did want to go over who might benefit the most from getting this test done, because insurance doesn't always pay for it, and so you may want to determine if it is appropriate for you or not. So number one, if I have somebody who actually does have high LDL, but they're on the fence of doing anything about it, such as a medication or a supplement, and they just want to do their diet and exercise, then I like to do the advanced testing because it gives me further assessments of their risk if that is a viable option, or if it's something that we need to be more assertive to treat because they might be at higher risk for heart disease. The other people are people who may have a normal LDL cholesterol and who have other risk factors for heart disease, such as insulin resistance. If you have low HDL, which is your good cholesterol, and or high triglycerides. If you have a waist to hip ratio that is greater than 0.85 in women and greater than 0.9 in men, then this can indicate that you carry your adipose tissue around your middle. Also, if you have high blood pressure, if you are a smoker, and if you have diabetes, and conditions that cause inflammation, such as autoimmune disease. On the traditional cholesterol test, we measure something called an LDL-C. And the LDL-C is actually just the total weight of your LDL cholesterol that's in your bloodstream. But in order for this LDL-C to be transported and taken to your tissues to be used, it needs LDL particles to carry it. Now, these LDL particles can be large or small. If you have more larger LDL particles, then you need fewer particles overall because the larger ones can carry more of that LDL weight. So you need fewer of them. But if you have more smaller LDL particles or LDL-P, then you need more of them because they're small, so they can't carry as much LDL-C within each particle. And so your LDL particles overall tend to be higher. Now here's the crucial part. If you have more smaller LDL particles, then these are more plaque forming. These are the ones that can embed into your arterial wall and cause plaque formation and cause damage to your blood vessel walls, increasing your risk for heart disease. So measuring an LDL particle number can actually give you a better assessment of your cardiovascular risk than just an LDL-C alone, because the particle number will give you the number of particles, and if they're high, you're more likely to have more smaller ones, and if they're low, then you're more likely to have more larger ones carrying around that LDL-C. Don't assume that a normal LDL cholesterol does not put you at risk for heart disease. Get the further advanced cholesterol testing done and see what your LDL particle is. And then the other scenario are people who have a high LDL-C and they're reluctant to start a medication or a supplement. They just want to continue the diet and exercise. Getting an advanced cholesterol test might give you more information. Another factor that I look at on the advanced cholesterol panel is the size of your good cholesterol, which is your HDL. Larger HDL particles can be more cardioprotective because they are more efficient at removing your LDL and taking it back to the liver for processing. They also are anti-inflammatory and also have antioxidant properties, so they can counteract inflammation and something called oxidative stress. Because when you have inflammation and oxidative stress, that can really jack up your risk for having a heart attack in the future. You want to do what you can to lower your inflammation and oxidative stress. Now, the smaller ones aren't as efficient at removing the LDL, and it also doesn't have as much anti-inflammatory, antioxidant effect as the larger ones. So if you have larger good cholesterol, that is more cardioprotective for you, and if you have smaller ones, you're not getting the full cardioprotective effects of your good cholesterol. I'm about to go over some cardiovascular risk markers. Just keep in mind that when your doctor orders an advanced cholesterol panel, it may vary by lab as to what cardiovascular risk markers are on there. So you may want to check with your lab if you're interested in a particular cardiovascular risk marker. These cardiovascular risk markers, many of them can also be ordered separately. So if it's not within your budget to get the full panel, then you may want to just order the standard cholesterol panel and then one or two cardiovascular risk markers that I'm about to talk about. And that might be enough to assess your overall cardiovascular risk. So the first one I'm going to talk about is Apolipoprotein B. So on those LDL particles that I had mentioned earlier that carry your LDL-C through your bloodstream, all of them have an Apolipoprotein B on them. This is an indirect way of measuring your LDL particles since you have a 1-to-1 ratio. So if your apolipoprotein B is high, then you're likely to have a higher number of LDL particles and thus having more smaller LDL particles, putting you at higher risk for heart disease. So if your LDL is normal on a standard cholesterol panel and you have a high apolipoprotein B, then that can indicate that you're at higher risk. All right, so the second cardiovascular risk marker that I'm going to go over is something called an Apolipoprotein A1. This is the main protein component on your HDL cholesterol. And generally, if you have higher levels of ApoA1, then you're more likely to have larger HDL particles, and these can be more cardioprotective, as I mentioned earlier. The next cardiovascular risk factor that I'm going to go over is lipoprotein A, or Lp(a). And this is similar to an LDL particle, except that it has something called an apolipoprotein a attached to it. Now, this is different than the apolipoprotein A1 that I mentioned in regards to the good cholesterol previously. When you have this Lp(a), this is actually genetically determined how much you're going to have in your system. And it can be maximally expressed by the age of 2, and then it may slowly increase through adulthood. However, if your Lp(a) is high, then there is a much higher risk that you may have some sort of cardiovascular event, such as a heart attack or a stroke, independent of what your cholesterol is or other risk factors are. Now, the unfortunate thing is there's not really any medication to treat this. So taking a statin or other cholesterol medicine may not necessarily lower your Lp(a) since it is genetically determined. Now, niacin, fibrates, and the PCSK9 inhibitors, which are other types of cholesterol medicines, may lower your Lp(a) a little bit, but it's not significant enough to where it has a recommendation to start on these if you do have elevated Lp(a). But if you do have this, then you definitely want to be more aggressive in treating any of your risk factors. So whether you're pre-diabetic, whether you have high blood pressure, whether you have high cholesterol, because if you can't lower your Lp(a), you want to make sure you lower your other risk factors so that way at least you have a fighting chance not to have a stroke or a heart attack in the future. Now, having said that, I don't want to freak everybody out because if your Lp(a) is high, it doesn't necessarily mean that you're definitely going to have a stroke or heart attack, but it definitely means that you are on the higher risk for it. So you definitely want to engage in healthy lifestyle choices, reduce your inflammation, eat a lot of antioxidants so you lower your oxidative stress, and you want to control your other risk factors. You want to quit smoking if you smoke, and then you have a chance of avoiding cardiovascular event in the future. Now, there are some medicines that are being studied on the horizon, and they may be released in as little as a year or two that do look very promising. So I'm very excited about that to come out in the future. So there may be hope for that. The next one I'm going to talk about is something called LP-PLA2. And this gives us another indicator as far as if you have stable plaque or not. If it's higher and you have plaque in your arterial walls, then it is more likely to be unstable. And when you have unstable plaque, then that is what's going to cause you to be at very high risk for having a heart attack. So if your LP(a2) levels are high, you definitely really want to be more assertive in treating your cholesterol levels and other risk factors. All right, so hopefully you're still with me. And if you are, kudos to you because I know this is a lot of information. We just have a couple more cardiovascular risk markers to go. The next one is high sensitivity CRP. And this is basically just a marker of inflammation. And as I mentioned earlier, anytime you have chronic inflammation, that is going to increase your risk for plaque developing in your arterial walls and being unstable, and that's what can cause a heart attack. So you want to do whatever you can to reduce inflammation by making sure you're eating healthy, sleeping well, keeping your stress low, and exercising. If your CRP is high, then that indicates that you have inflammation. Now do keep in mind, if you are sick, you don't want to get this test done, or if you've just worked out, because it can falsely elevate it, because CRP can be elevated even with infection. But if your CRP is chronically elevated, then you have chronic inflammation. And it doesn't even matter if that CRP is high because of a chronic inflammatory disease such as an autoimmune disease. It doesn't matter where the inflammation comes back from. If you have inflammation, it is going to increase your risk for heart disease and other cardiovascular events in the future. All right, so lastly, I'm going to talk about something called MPO, or myeloperoxidase. This is an enzyme that is found in white blood cells and is a marker of inflammation and oxidative stress. Elevated MPO levels have been associated with an increased risk of cardiovascular events. MPO contributes to the formation of atherosclerosis, or plaque in your arteries, by modifying LDL through oxidation. So anytime, as I mentioned, you have oxidation, it increases your risk for a cardiovascular event. It also causes inflammation in your vessel walls. So if you have high levels of MPO, that can also indicate that you may have unstable plaque in your heart arteries, and that puts you at risk for heart disease. All right, so those are the most common cardiovascular risk markers. Hopefully you have some information that you can take to your doctor and discuss if you need any further advanced cholesterol testing. It's always best to find out more information and be proactive about your heart health, because there is a lot that you can do. All right, well, thanks for watching and have a fantastic day.